My greetings and salutations, everyone. My name is Trevor Emojel, and I am the youth coordinator AHF Uganda Cares, where I coordinate the youth programs that are consisting of the HIV care and treatment, prevention, and advocacy programs for young people in AHF Uganda Cares. When I joined AHF, I just like to give that a very important segment. That was 2014, and I was sick. Let me say almost bedridden. I joined AHF with tuberculosis. I was really not well, and it was a referral from one of the people that thought AHF was a very good facility, and they thought that at that time I would be able to get the right support by getting to AHF. But when I got to AHF, it was such an interesting turn of events for me, because then the health workers were more supportive, they were more friendly, and so I was really feeling the quality care at the time. And luckily 1 year later, that was around 2015, I was able to bounce back, through the counseling, support, love, family as well, meeting fellow young people living with HIV, and there was a lot of, morale and knowing that you're not alone, and, people boosting you up. And yes, so that was such a tremendous turn for me, and my journey ever since then has been nothing short of transformational, because I was able to get into leadership with AHF, even if as simple as peer counseling with my fellow young people. That transformed, first of all, my personal outlook on HIV and living with the virus, and now taking me from being a victor to a leader. Around 2016, when I was now in the real deep recovery phase, I was reached out by the management then, and at that time we really didn't have a very formal structure of youth engagements, but they were tracking young people who were making it, who were able, who had recovered. And so that's how my journey started. And my journey with AHF, like I mentioned, has been really transformational. From being a peer leader at the time, I was still in university, but also doubling my roles because I was also leading in university. I just made sure that I used both experiences to better lives of people in school at the time, and also in the facility where I was working, because it was voluntary, so I could switch between roles. But after my university, I am glad to say that I became the youth coordinator, AHF Uganda Cares, and so here I coordinate or manage the youth programs, and this is in HIV care and treatment, prevention, and then advocacy. It's quite a broad program, and I'm glad that I have the opportunity to lead and mentor and nurture and support fellow young people living with HIV to grow in just like I did with my journey. So we've ensured that we are strategic in our partnerships, working with key national bodies that deal with young people, like the National Youth Council, the Parliamentary Forum on Youth Affairs, the Ministry the ministry that has young people, and that's our Ministry of Gender, Labour and Social Development. So what we do is we are strategically working with these bodies to ensure that we are part of these critical working groups, discussion spaces. We are part of frameworks, and ensure that we put the HIV and the health discussions right at the center, because most of these are getting forgotten in these youth spaces. So we do this through our young people, because we've mentored them, and we believe now they have the capacity to be in such spaces and influence and lead in discussions. But of course, all this is under the support and guidance and full leadership of AHF management. So, I've written about AHF work through abstracts, and last year I wrote about our Girls Act in the IAS, and it was accepted and it was presented. This year I also wrote about advocacy with high-level spaces for a conference in Kenya, and it was still accepted, also here nationally. So that just shows that I'm proud of the work that I do, and there is a lot that people can learn from AHF. When I was sick, I recall getting visited by the management. I remember members of Secretariat coming to see me. Also the 20-year celebration, when we had Terry Ford coming to Uganda, I remember sharing a panel discussion with her. It was such a life-changing experience for me as well, because I was still a young man. But then AHF giving me the opportunity to have that discussion, and they were really warm and supportive. Oluwakemi's stay here in Uganda as well, they were really close to us. And so for me, the special moments have been the humility of AHF coming to a client and embracing them and making them feel loved, special. For me, has been very, very touching.